Thank you, everyone. It is really a privilege to be here today and to talk to you about collaborating, educating, celebrating. And I want to focus today on talking about the role of particularly the most important people in our team, our patients, our consumers, and they've been really integral to our success. I'd like to start by saying Kaya Wanju Noongar Boodja and acknowledging the Whadjuk people of the Noongar Nation, paying my respects to elders past and present, and it's a privilege to be on Noongar country today. And helping me with my acknowledgement to country, thank my wonderful colleague Dr. Margaret Gidjup for the loan of her beautiful artwork to help my acknowledgement to country. So thank you, Margaret. It is fantastic to present on behalf of the team, and we have a large team. Some of our people move on, and we always say to people, they don't realise this when they come to us, but we say, now you've joined our team, you can never leave. So it's a bit like Hotel California. And we have a lot of people out there in other fields that we think been excited to parachute them into new and bigger positions, because I always say our team is small, but our team helps you launch yourself off into even bigger settings. So big sing out and call out to all our colleagues and all our successful people who are off with their careers. I'd like to talk to you about our consumer collaboration in the context of talking about the type of work that I do. I focus a lot on talking interventions, patient education. Why do I do that? Well, as a physiotherapist from day one, when I started work, I was a student on a Friday at Charles Gardner Hospital, and I was a physiotherapist on a Monday. So I just went onto a ward and there was no longer a physiotherapist to tell me what to do. I had to do it myself. Somewhat daunting. And I very quickly realised, and I think most of my colleagues do, that physiotherapy is an intervention that I can't do for anybody. I can't make any of you exercise. I can exercise myself, I can explain to you exactly why it's important to you, but I can't actually do it for you. So for allied health, interventions are often very focused on working so closely with our patients. We need to inspire our patients to want to get out of bed. And for me, working with older people, when many of their family, friends, and implicit messages they receive in hospital permeate, they come to a belief that it's not worth getting out of bed. So working with older people, I need to inspire them that there's much to live for and that they can improve. And my colleague Jackie Francis Coate and I, when we started our masters, began to look up all these studies, and we would go out to the library and we would find ever more studies saying, look, here's a group of people aged 97 and they increased their muscle mass from exercise. And then being very raw and new to this, we would go and tell our patients that. It wasn't always warmly received. We'd say, don't worry that you're 97, we have evidence you can improve. So we've learnt to be a bit more professional in our talking intervention since then. So this is a recent trial we published in JAMA Network Open, where we gave people a telephone intervention. So we never saw them at all. We spoke to them on the phone for 6 months. And I want to talk to you about the role of Howard, our consumer, who helped us with designing the trial, who helped us with feedback throughout the trial, and we note him there as an additional contribution. And you notice that recently we've started to publish the follow-ups of this trial, and Howard is an author on our follow-up publications, and he's given us really important advice. And one of the things in this recently published paper in the Journal of Nursing was that he thought that some of the terms that are used in the mesh browsers about carers he felt limited-based and not strengths-based. And he wanted us to phrase our article in a certain way and leave out some of the words that he felt are not words that resonate with carers, like burden, burnout. He didn't like those words. We took his advice and we think our paper is cutting edge because it actually contains advice from a consumer who is a carer. We're doing a trial which we have just started, and we will be rolling out the intervention arm at Royal Perth very soon, which talks about patient falls prevention education in hospital. So we talk to our patients about education. To do that education, we have joined with our consumers. So we invite older people, we have consumers on our research team, we have consumers we work with, and we have consumers that we invite in. And we talk to them to say, how should it be done? What should we do? How should we deliver this information? Because again, we know that when you have a patient in hospital, we want that patient to understand what's going on, and we want to work with them. And our patients can't understand if no one explains it to them, if no one gives them some information in a simple way and helps them to figure out, well, what should I be doing? Our patients are older adults. I include myself in that. And they've got 60, 70, 80, 90 years of experience. So believe it or not, they do know something. And some of our patients have told us that. They've told us that and said, it seems that the doctors and nurses don't think I know anything. And so it's really important to us to have our consumer perspective and present our information in the right way. And so when we are working with our consumers, here we are here at one of our events, and there's our researcher, Stephen Peterson, who is a consumer. And he is a research member of our team, has attended the recent event we held there, and has been part of the authorship team. We also ask our consumers to help with staff training. So you can see we're making some videos there, and those patients in the beds are actually consumers who've come along to help us so that when we deliver training, it will be authentic, because we don't rehearse. We actually talk to the education, talk about what we're saying, and then we wait for the response from our consumers. And if they respond with, I don't get that, we know that we need to redesign and re-talk. And some of our consumers, we've had to retake a few of those if we all start laughing, but our consumers help us at every point. And when we roll out our interventions across hospitals, as we're about to start doing at Royal Perth, we'll be asking our consumer, a couple of our consumer members, to come along to the hospital and to walk around with us and see what they think. We have been working hard on making sure that we include and make accessible health knowledge to people from diverse backgrounds. And we recently presented falls prevention education to Chinese older people. This made such an impression that it was the MRF kindly presented that in their recent bulletin. And that made such an impression that UWA media, who I find quite hard to get hold of at times, and they're not terribly interested in my saying I talk a lot to older patients, I said, well, you know, this is quite interesting, and they took it up. And we then received follow-up from SBS News. And we had an article Saturday a week ago on SBS World News. So the first item was problems in Gaza. The second item was a problem in Africa with famine. And my husband said to me, Anne-Marie, you've got this wrong. It's probably on a local news. You've missed it. And I said, no, I got told it was on the world news. And so we sat there, and in the third item, Anton Ennis read, now, did you know 1 in 4 older people fall over? And I was like, oh my gosh, like, I never thought I would be able to get that attention on the news from talking to Chinese older people. And they were very impressed. And again, they said, though, which I find a little sad, they said, isn't this wonderful? This is the first time we've heard this. I never knew this. When I went to hospital, I felt very disempowered and afraid. This is really good. I feel I know a lot more. So, fantastic outcomes. We've also been working on the TREDx program. It's a fantastic program by my colleague, Dr. Jackie Francis Code. And we got money from the HCF translational research grant because HCF have noticed where are all their insurance claims coming from? Older people falling over. So we designed all these messages and the whole education program and all the exercise layout with older people and their carers and those living with dementia. We designed the program with them, set it all up, and then began to roll it out. So we knew that it would be positive because we'd already prepared to see what our consumers would want. And I'm hoping I can play this because I couldn't talk to you without having our consumers talk as well.
Well, first of all, I thought it was great that the university was going to reach out to people in their homes, because today, unfortunately, a lot of seniors get missed out on lots of things. But this was just, pointed towards them. It was for them, and they felt that they were taking part in something that they could add to. Now, like myself, just being in the program.
Because it was a new program that we were participating in, the feedback that we were able to get and was sought from the people who were running it was really good, to feel like you were helping other people, not just yourself. So I thought that part was important, and I'm really interested in how it all develops.
Our consumers, you notice how politely they're not people, they've taken Professor Wood's advice, they're not sitting around complaining, but notice how they very politely mention seniors get left out. So they're just politely alerting us to the ageism that's around. And their positive feedback and their input throughout the whole program has been so helpful for us. I'd like to just finish, because there's such a lot of scientists in the room, by just saying it can be easy to think that talking interventions are not powerful. Yet we all know that if our patients don't understand what's required, it's going to be far less likely they do the tough rehabilitation. I was thinking of my colleague, the wonderful Dale Edgar, when Professor Wood was talking, and the effort that it costs people with burns to get out of bed and start walking. How are we going to explain that? And I just want to finish by saying in our FETCH trial, randomised trial of over 540 people, measured over 12 months, outcomes all measured over the telephone by blinded outcome assessors, we find that by our nurse ringing carers after older people go home from hospital, our caregivers in the intervention group were significantly better prepared to care, had significantly higher levels of self-efficacy at 12 months, and had significantly less distress. So they received telephone calls, and that made them more prepared to care, made them feel better, made them more able to take on a role in a healthier way. And we look forward to measuring some of those follow-up outcomes of how that's helped our patients. So once again, I'd like to really thank all our consumers who work with us. We value their input so much, and thank you for your time and listening.